When wealth is lost, nothing is lost. When health is lost, something is lost. And when character is lost, all is lost, by Billy Graham. I'm not sure how much you lost or character changed by PCOS. However, I believe there is still a way to heal you. Today, I will share with you some study case of one of my clients and how we solve her PCOS problem. Polycystic ovary syndrome, or what is called PCOS, is a common endocrine disorder predominantly affecting reproductive of young or middle-aged women. In most cases, it can lead to high sugar levels in the blood, which leads to insulin resistance and does not work well with ovaries when coming to ovulation. Who gets acne? Acne is a common manifestation of hyperandrogenemia or high androgen levels, which mostly can be impacted by high testosterone levels. Acne issues are common in females who are struggling with hyperandrogenemia in PCOS. The purpose of this case study is to determine the PCOS in women with acne and how best is to heal it. Acne problems are very common with women starting from the age of 15 to 40 years old. My client is Maseho, she's a 35-year-old female with a complaint of acne and have not received any hormonal therapy or treatment, if not medication. Her history was irregular menstrual cycle since last 1 year. The severity of acne was graded as a mild, moderate, or severe by her doctor for someone at the age of 35 years. Weight was 58 kg, which I'm a bit concerned about it. The height of 175, body mass index not normal with that height. At least she should be around between 62 to 73 kg with her height, which can be another reason for PCOS, as being underweight is another type of phenotype of PCOS. Menstrual history irregular and androgenic signs were recorded. Hormonal assay and pelvic ultrasound was done by her doctor. Personal history, a detailed comprehensive, reveals she's having this problem from age of 17 years. And at the age of 21, birth control pills were prescribed to regulate her hormones. In the beginning, the weight gaining slowly started and lately increasing faster with no explanation. Maseho has been eating fast food due to traveling, work nature, highly stressed job, family history of diabetes, and sedentary lifestyle, which helps to aggravate the disease. Our discussion, which touched the subject of hormone impact, obesity, being underweight, even if she's not really overweight but underweight. Having 58 kg weight and height of 75 is a little bit concerning for me. The vital signs were normal or found to be normal. Advice I gave her through our coaching program was this: to avoid cold food, reduce salt, introduce fermented food for increasing gut probiotics or microbiome for increasing good bacteria, remove the spicy food, simultaneously to maintain a stress-free lifestyle, and start resistance training to clear insulin from the blood system. And we also introduce a little bit of now where she have to eat a liver a couple of times to 3 times in a week to be able to help now to regulate the liver, to detox as well at the same time, or to regulate as well for help with infusing the ovulation, which the liver is good in doing that as well, for HbA1c. So the supplements were introduced with a combination of cruciferous vegetable, a lot of mixed leaf. We up her protein intake based on her weight as well. We introduce it to from 55 gram to 100 gram because we wanted to start picking up muscle, the muscle which is going to help it to clear the insulin out of the system. And we start introducing supplements like where we start introducing vitamin E, vitamin A, omega-3, vitamin 3, D3, magnesium glycinate. We introduce obesitol, which is anisotol in a lot of people, to help that. And we start now infusing other of the herbs as well on the side, where she was doing the spices, which I'm not going to code everything because every person will vary depending on what is the condition of the situation. And Maseho, in the second month, after reducing and removing all the junk food and everything, she started having her first periods. And as time goes on, she started losing weight as well. On the second month, we started having another second period, which was a wow, for her for after a year. So remember, each and every person when coming to this study case will vary depending on where you are or how long it's been going or what are you taking. Some cases they might be more complex to get the first period on the first month or 2 months. Some people, they might need 4 months, but most of the time 2 months, second month, I expect you to have your periods. That's what I see with a lot of my clients when I work with. Maybe I don't know how long you've been struggling. I told it will vary from individual. And then we also brought some of the supplements to help her with sleeping, or we infuse some of the food programs that we infuse, like introducing cinnamon and banana to help you to sleep more. We also start infusing things like B5 as well to help with the acne, for the skin clearing. So there's a lot of methods you can put there, if not the herbs. I don't want to talk about the herbs, but I'm talking about what I did with the supplements. But the supplements that were added as well, we can add white pony, we can add it, the cinnamon as well is part of that as well. We can add like the ashwagandha as well as part of that. So everything has its own step where it comes in. But today is not about the herbs, it's about the process I did when coming to Meseho. That's why my brain even is not thinking about that, because every case it have its own way of dealing with it. So if maybe you lost your health, wealth, we said we can regain it. But what I know about your health, a lot of people, they can struggle to regain it. So it's never too late for you to start changing your health. So reach out for me if you're looking for a change, and we can put something in place for you to start now looking at how can you fix your issue and start living a happy life and fix your irregular periods and your acne issues. This video was made not to diagnose anything, was just on information of educating you and teaching you what is the best way to go out there and be able to solve your acne problem or your PCOS issues. So mostly this video was focused on acne issue, and we got a lot of other things if not acne issues. I hope you enjoyed this video, and I'm looking forward to hearing from you. Comment below or share the video or subscribe to my video channel. Go to TikTok, you'll find other videos. Go to Instagram, under Daniel Wellness, and that's where you're gonna find me. Thank you very much.